Hello again, everyone, and welcome to the third episode of the Down Syndrome Center podcast. As always, I'm your host, Dr. Kishore Velody. We are pleased in this episode to once again welcome back Dr. Andrew Nowalk, who is a pediatric infectious diseases physician here at Children's Hospital of Pittsburgh of UPMC. In the last podcast, we talked about why Dr. Nowalk is so involved in the Down syndrome community as a parent and as an advocate through the Down Syndrome Association of Pittsburgh. Today, we're going to explore those infectious issues that Dr. Nowalk deals with in his clinic. We'll get into some of those reasons why kids with Down syndrome are at increased risk of infections and what can be done to reduce those risks. Hey, Andy. Thanks again for joining us for this podcast. Can we just jump right in? Can you tell us why kids with Down syndrome seem to get more infections than other kids?
Sure. The issue of infections in Down syndrome is one, certainly, too, that we know about from way back. As soon as people started describing children with Down syndrome, they noted in almost all of the earliest papers, besides heart disease, which is one of the really big associations with Down syndrome, that children with Down syndrome got infections all the time. And those reasons are complicated, but we can really put them into two big categories that predispose children with Down syndrome to infection. Number one is the simple anatomy, how they're made, how they come to us. And we notice certain features of children with Down syndrome that make them noticeable to your eye immediately. You could pick another child with Down syndrome out of a crowd almost instantly. They have the very, very specific shape to their eyes and the tilt of the lids of the eyes. And their nose tends to be a little bit flatter in the bridge. And in fact, if you really look at them, the whole center of their face is a little flatter and a little less sloped outward than other children. And unfortunately for kids with Down syndrome, what that means is that the bones that make up the middle of the face also are a little bit flatter, and things behind those bones, the nasal passages, the eustachian tubes, all of kind of the anatomy of the nose and throat and ear area is smaller and tighter. So we're talking about much smaller and tighter tubes, and when they get inflamed and clogged up with a virus, it's a lot harder for them to drain out, and therefore children with Down syndrome are easily going to get infections in those areas where another child with more typical anatomy in those areas wouldn't.
I have to say, it's kind of sad to me that the things that, I think make people with Down syndrome have just distinctive beauty are also the same things that increase their risk for infections. Can you give us an idea of what types of infections are seen in Down syndrome because of these anatomical issues?
We see ear infections almost monotonously in the first few years. And one of the most frequent introductions of a child with Down syndrome to the medical system is not only the Down Syndrome Center of Pittsburgh, but it's to the Ear, Nose, and Throat Division at the Children's Hospital of Pittsburgh. So those children will often end up needing an ear tube to help them out with their frequent ear infections. Later on, or coincident with that, those kids get sinus infections all the time. And one of the most common reasons for me to see a child with Down syndrome in my clinic is the treatment of recurrent antibiotic-resistant sinus infections. And so I work very frequently with folks in the ENT division and see this quite a bit. So all of those come from not necessarily weakness of the immune system, but just the way God made those children. Mm-hmm. So we have to deal with the tightness of those connections, and we're often very successful. Ear tubes will help out the children who get frequent ear infections. With sinus disease, age more than anything else helps them out, but antibiotics can certainly help, and we have another bunch of tricks up our sleeve if we need to.
Thanks, Andy. You had mentioned that there was possibly some weakness to the immune system in people with Down syndrome. So does their immune system play a role beyond those issues with anatomy that you just explained?
There are some things in children with Down syndrome that suggest it's not just their anatomy that's not normal. So if you look at a child with Down syndrome around this time of year when we have a lot of respiratory viruses running around, so everybody has a cold and everybody has a runny nose, some of those viruses in the first year of life are particularly hard on children. And one of those viruses is called RSV. And RSV has been studied in children with Down syndrome, and if you correct for all of the other things that go on with kids with Downs, especially heart disease, it seems that RSV infection is much more severe in children with Down syndrome. And what that points out to us is that there's probably some issue with the immune system in children with Down syndrome. When we've looked at them in the past and studies have looked at how they react to vaccines, they seem to react to vaccines a tiny bit less well than other children. We're not sure if that explains everything that goes on, but there does seem to be some immunology behind this, as we say. So something about the immune system in Down syndrome that's a little less good than other children. We're not discussing an immune problem that's dramatic, where the children have no immune system, or like a child who's getting chemotherapy, they can't react to an infection. But children with Down syndrome do seem to have some trouble handling typical infections when you compare them to other children.
Well, Andy, let me tell you what I hear from some parents that I see in clinic. They've heard from other people or in their own research on the internet that kids with Down syndrome have a weaker immune system. So then they naturally wonder, should we not immunize our child with Down syndrome? After all, if their immune system is weak, aren't they running a risk by immunizing their children with all these vaccines?
So I've done a lot of thinking about this to try to help with the guideline development in kids with Down syndrome. And my point of view, when I know your immune system is a little bit off, is that I would give you more vaccines rather than less. So the question you bring up, whether an immune system can't handle it, in actuality, we know that children with Down syndrome do react to vaccines. And for that matter, because we know that they're susceptible to these infections, we have even more reason to vaccinate them, not less reason. So when your child has Down syndrome, the first thing you should do is make sure that that vaccine schedule that you get from your pediatrician or family doctor is followed to the letter. So we really don't want to see any child with Down syndrome be behind on their vaccines. We want to make sure that they're up to date on the latest vaccines, many of which have been designed to help them protect against the infections we just talked about. So we talked about sinus infections and ear infections. Some of the vaccines we give, like Prevnar 13, really provide some level of extra protection against those infections. So we're really interested in those children getting the most vaccinations that they can.
Okay, Andy. So let me just clarify this point, because I know it's an area where some of our families have questions. What you're saying is that even though the immune system is a little bit weaker in a child with Down syndrome, that they're more than capable of handling all these recommended vaccinations? And you're saying that by giving them the vaccines on the regular schedule, we can help protect them from potentially serious infections?
That is correct. I think they need to be on the regular schedule, and there shouldn't be any different for them from another child.
Thanks. I agree completely, but I just wanted to be sure that our listeners completely understood your expert advice. Well, are there any other vaccines in particular that our families should be aware of?
There are some vaccinations that we really think are critical every year. We know Down syndrome, both children and adults, have a particular problem with getting pneumonia and suffering some difficulty with it. So this is influenza season. Influenza is one of the most common pneumonia-causing viruses around now. We have a vaccine every year. It's typically available at your pediatrician or family doctor's office in August now or September. The vaccine companies have really pushed to get it out there early. Make sure your child gets influenza vaccine. And because we know that people around the child shouldn't get sick and pass it on to the child, make sure everyone in the house gets influenza vaccine. One of the best ways to protect your child or an adult with Down syndrome is to make sure everyone else around them is protected too. So that's a really simple and easy way to prevent what can be very severe infections in children with Down syndrome.
So Andy, you're saying that influenza vaccine is especially important for a child with Down syndrome to get?
Yeah, I can't stress that enough. Yearly vaccination with influenza is one of the easiest ways to protect your child with Down syndrome. I think of it like putting on their seatbelt. Nobody ever forgets a seatbelt for those little kids. We should remember influenza vaccine in the same way.
Yeah, I like that analogy. You know, we've had a lot of children get admitted this year, some of them seriously ill with influenza illness. And I think what makes it hardest for me is that the illnesses were all potentially preventable with a vaccination. I think you've got a slogan in there. Buckle up and go get your flu shot. Hey, well, before we run out of time, let me ask you if there are any other vaccines for kids with Down syndrome that our family should be paying special attention to.
There's one other vaccine, too, that I'll mention because it's a vaccine that we would think about more as an adult vaccine. And it's got a funny name, Pneumovax. And it's a vaccine we had previously given mostly to elderly people over the age of 65. Pneumovax is one vaccine that has really been moved very dramatically into the childhood vaccine schedule in the last 5 or 10 years. And children with Down syndrome who get tons of ear infections, tons of pneumonias, tons of sinus disease are pretty much the ideal target population for pneumovax. This is a recommendation that's very strong from most infectious disease practitioners for any child at increased risk of respiratory disease. And Down syndrome children fit that bill perfectly. So pneumovax is a vaccine that I would really encourage any parent to explore with their practitioner if they haven't received it already.
That's true. This is one vaccine that most pediatric practitioners will not be as familiar with because, you're right, we do usually associate this vaccine with the elderly. But just so our listeners know, the latest guidelines for the care for kids with Down syndrome states that all kids with Down syndrome and any chronic cardiac or respiratory condition should receive the Pneumovax vaccine one time after the age of 2 years. Currently it's a one-time vaccine, but probably future guidelines may update it for regular booster shots at later dates. And we should all remember that the ears and the sinuses are technically part of the respiratory system, so I've been recommending this vaccination for many of my patients. Hey, look at that. That wraps up our time we have for this podcast. Thanks, Andy, for being with us again for the podcast. It was really fun exploring the personal and medical interests you have when it comes to Down syndrome. But hey, for our listeners, don't forget to keep sending in those questions to downsyndromecenter@gmail.com. We'll be back next time with another topic. Until then, take care and go get those flu shots. Bye-bye.